Segment is sponsored in part by One Brooklyn Health.
December is HIV Awareness Month, and our next guests are on a mission to keep New Yorkers healthy and in the know.
HIV specialist Dr. Jessica Yager and Dr. Joseph Paul from One Brooklyn Health are here to talk about what you need to know about HIV. Thank you for joining us today.
Yeah.
Thanks for having us.
Very important
Good
subject.
morning.
So, Dr. Paul, what should New Yorkers know about HIV?
As it is now, we do know that the rate of HIV is declining. However, in New York City, approximately 87,000 people are living with HIV. And I may say the central Brooklyn area has the highest rate. Now, both with people having HIV and the known diagnosis of HIV. But we also know with medication, there is possibility for people to take medication and therefore they will live a normal life. A life which is approximately the same like people not having HIV.
Sure. Okay. So that brings me to my next question for Dr. Yager. What does treatment for HIV look like these days?
It's really pretty incredible that most people diagnosed now with HIV infection are able to take one pill once a day, and as Dr. Paul mentioned, live a otherwise normal and healthy life besides that one pill. So the other really nice thing about the medication is that when people take the pill, it keeps their virus what we call undetectable. And people living with HIV on medication who are undetectable are not able to transmit or pass HIV on to their sexual partners. So it's also, really important for their own health and the health of their partners.
Wow, really come a long way. Can we talk about prevention? What can people do to stay safe and be aware of their HIV status?
Well, at One Brooklyn Health, at Brookdale, we've rolled out the universal testing. We're offering the HIV test to each and every patient who come to our door, both in primary care clinic and also in the ED department. The people who tested positive, obviously, we do what we call the early start. We start them on medication as early as possible. Now, the ones who are negative and who happen to be at risk of HIV, they have the option of taking medication also. Could be one pill daily or an injection to prevent them upon having HIV. So with that now, all those people being identified, they are on medication. As Dr. Yager said, they are on medication. They have a viral load which is undetectable, is untransmittable.
Right.
Now, Dr. Yager, what is the most important message maybe that you want people to hear during this HIV Awareness Month?
Yeah, I think it's really important to know that in spite of all the advances we've made and in spite of how well people do now, there's still a tremendous amount of stigma around HIV, and it's so important for people to know that this is a virus like any other virus that people can get from other humans who they interact with. But that it has much better treatments than most of the other viruses we deal with. So it's really important to know that this is an infection, like so many infections out there, and we can treat it so effectively, we can prevent it, as Dr. Paul mentioned, so it's just so important that people are aware of it, get tested regularly like you would for diabetes, for high blood pressure, so people are able to take care of themselves and their loved ones.
Well, Dr. Yager and Dr. Paul, thank you both so much for all of this information. I'm sure our viewers are much more enlightened. And for more information on HIV care and treatment, scan the QR code on your screen to visit One Brooklyn Health. We'll be right back.